Welcome to Novant Health in Focus. I'm Victoria Bellamy, and I'm here with Dr. Erin Wallace, who specializes in internal medicine with Novant Health Oceanside Family Medicine, Bolivia. Dr. Wallace, thank you so much for being here today and just taking the time so that we can learn more about you and your clinic.
Yeah, of course.
So we were talking a little bit, you said that your family moved to Brunswick County before you did. So did you decide to follow them here?
Yeah, so my family moved to Brunswick County when I was in college, specifically Charlotte. And I met my husband in medical school, and luckily he also was willing to move to Brunswick County and call it home. So we've been here since July and really happy to be here.
That's awesome. Well, it's a great place to live, so y'all made a good choice.
Yeah.
So did you decide to specialize in internal medicine?
Yeah, so I knew after college I was a scribe for a primary care doctor, so I wrote all of her notes, and I loved primary care. And in primary care, you can either do family medicine or internal medicine. Family medicine, there's pediatrics and obstetrics and gynecology, and I knew that I wanted to specialize in adult medicine specifically, so that's why I chose internal medicine.
Okay. And so you have a special interest in geriatric medicine, is that correct?
Yeah.
Can you just share a little bit more about, why that's a passion for you for that patient population?
So I was really close with my grandpa growing up, and I used to, when I started driving, take him to doctor's appointments. And so I learned how important it is to really look at the whole aspect when you're taking care of a geriatric population. How are you doing medications? How are you getting around? How's your mobility? Do you have family support? Those things. So when I knew I wanted to do medicine, I knew I wanted to be with geriatrics.
That's awesome. And why do you think it's important to foster a trusted relationship with a primary care provider?
For a lot of the reasons I just said. So our health is so dependent on everything else that happens in our lives. So what's happening at home, what's happening at work. If you have someone that you really trust and you know they have your best interest in mind, then you're going to share more with them, and I can really help make a difference when I know everything that's going on.
And so mental health conditions, let's talk about that for a little bit.
Yes.
Anxiety, depression, those can be linked back to our physical health. So does your clinic help treat these conditions as well, and can you point people to additional resources when needed?
Absolutely. So our clinic, all of the providers in our clinic are really happy to treat anxiety and depression. And there's counseling that goes in addition to medications. So we can put in a referral, and we have a referral coordinator for our office who helps figure out where your insurance works and who's accepting new patients. So it really helps take the burden off the patients when we have someone who's helping look into those things.
Yeah, that's really great. It makes you kind of just like the whole person, and awesome that y'all provide those resources. Primary care providers can certainly take care of sick patients and handle chronic illnesses, but there's also a huge emphasis on preventative care. Can you talk a little bit about the importance of annual well checks?
So I, as a primary care physician, think preventative care is so important because it's always important to figure out what's going on before it causes more problems in the future. So our annual wellness visits happen once a year. It's a physical, sometimes it's a Medicare annual wellness visit. And we get baseline labs so we can compare them to years prior, make sure that nothing has changed. And we also talk about preventative screening, such as mammograms, colonoscopies, things that we can do to catch cancer before it is a problem.
And while we're talking about cancer, I know there's a variety of cancer screenings, from colonoscopies to mammograms. Why are these screenings important?
They're important based on your family history and certain risk factors for each patient to get a baseline screening, and then we follow it every year for mammograms, every year or two for those. Colonoscopies, they're different based on the patient, but it helps to find something early if there is something there. That way we have more treatment options.
Okay. And going back to some of the other screenings that you kind of track year over year, why is it important to monitor and treat high blood pressure?
High blood pressure is so important to treat. I talk about this every day. So high blood pressure over time can increase your risk for heart attack, stroke, kidney disease. So even if it's not substantially high, but higher than our goal, it can increase your risk of these things. So it's really important to treat and get people at goal so we don't have complications in the future.
And are there any other health and wellness tips or just topics that you're passionate about that you would like to mention?
I love talking to people about diet and exercise. We all know that we should be doing healthy diet and exercise, but it's hard to incorporate into our daily routine. So I enjoy talking to people, hearing about what their life is like, and trying to figure out ways to fine-tune it to help prevent high blood pressure and cancer risk.
So I know there's a lot of respiratory infections going around right now. What tips do you have for your patients or for the community so we can try to avoid those things?
So the best thing to do is wash our hands, going back to the basics here. So wash your hands with warm water and soap. If you're around someone that's sick, make sure that you stay hydrated, get plenty of rest, and if you develop any symptoms, you should take over-the-counter cold medicine. If you have high blood pressure, it should be Coricidin. And if you're developing high fever, which is above 100.4, shortness of breath, a really bad cough, chest pain, those are all reasons you should see your doctor. Most respiratory infections are viruses, so they actually take 7 to 10 days to fully go away. But if you're having any of those concerning symptoms or it's getting worse, that's always a good time to call us and get in.
Perfect. And then I know spring is on the horizon, so tell us a little bit about allergies, how can we help deal with that when we're in the middle of allergy season?
Yeah, so allergies here in Brunswick County are worse than other places. So allergies are really important to treat. My first line for allergies is Flonase, the nasal spray. You can get it over the counter, and you do 1 puff in each nostril once a day. And then also Allegra, Zyrtec, Claritin, the non-drowsy forms are good to take as well.
Okay, perfect. That's great information. Can you let us know, are you taking new patients right now?
Yeah, so I'm at Oceanside Family Medicine in Bolivia, right across from the hospital, and I'm accepting new patients.
I know you're located at Novant Health Oceanside Family Medicine in Bolivia. Are there other primary care locations throughout the county if there's something more convenient for a patient?
Yeah, so there's multiple in our county. There's actually a few other Oceansides, so it can be confusing, but there's one in Charlotte, and then there's also one in Leland. So those are the 2 Oceanside. There's also a primary care clinic in Carolina Shores, so if you live on the southern part of our county, there's an office there. And then if you're sick, we have the Walgreens in Leland that has a sick clinic. And then we also have the Charlotte walk-in clinic. It's called Convenient Care that you can go if you're sick.
Dr. Wallace, thank you so much for joining us today. We've really enjoyed learning from you and hope to see you around in the community.
Yeah, thank you so much.